Welcome back to Global Health. This is Unit 12, and we're going to be doing Part 3, which is our exercise, or it's a simulation. We want you to build an HIV counseling center. No AIDS discrimination or stigma. So this is a t-shirt that we were trying to encourage people to use, especially among community healthcare workers or community members who are advocates of preventing HIV infection. That was one of the major problems in Guyana, was that it's actually the nurses at the clinics or the different people that are available to help patients as they're coming in, HIV positive patients, that they treat them very badly. And the rudeness just keeps people from wanting to come in for their care and treatment. So stigma and discrimination are a big barrier for people to get their care and treatment that they need. So here is Guyana. Remember, we have our little country here on the northern coast of South America. And here are the different provinces. So you can see that the Georgetown is the capital, and it's located here. The practical exercise that I'm challenging you with is that we have our international teams, and we are going to have a grant to build and operate a new voluntary counseling and testing center. So I want you to form groups. So again, we've got our blue team and our gray team. Form groups to create a list of steps, because actually once you have the steps and the outline created, the implementation becomes clear, and the resources you'll need and the budgets you prepare for your grant proposal will be all self-evident from just the basic steps of what you need to accomplish. So number one, select a new location. So I have the maps. You have them online in your library. You have the map that has all the different currently existing voluntary counseling testing centers, so VCT site locations. I want you to select a new site based on proximity to the individuals that would be high risk. So these will be men who have sex with men, commercial sex workers, also near high schools, and HIV positive community where they're located. Estimate client volume, that's number two, because again, the location of the site is one thing, but finding an area within a regular neighborhood where you can actually either build a freestanding VCT site, or else maybe you would adopt and renovate or adapt a currently existing building, or even a residence. You could take an older home that might be available within a neighborhood that's close to a high school or some other location that you feel would be important to be near. Estimate your client volume, because you need to know how many treatment rooms and the confidential areas that you should have auditory privacy. So you can't just put everybody in a great big open room and go into different groups. You have to actually have walls and maybe at least partitions of some type of to separate individuals. And counseling rooms typically are secure areas where people could have one-on-one conversations. Recruitment of clinicians, so you need to have your nurses and your doctors, as well as counselors, social workers, whoever you think would be important for the counseling center. Phlebotomists is an example of one of the health professional or auxiliary professionals. Administrative people, they have to be trained in how to do the proper record keeping and making sure that people's status, they lock the health files. So whether you're HIV positive or negative, those records are confidential. So you have to estimate your volume. You have to look for recruiting, who you're going to need working, and how it's going to actually fit in the counseling center. And then, as I mentioned, record keeping is very, very important for the potential. If you're found to be HIV positive, you'll be given counseling about the different types of treatment options that are available, and that treatment will be given to you for free. And the ARVs, which are antiretroviral drugs, will be calculated and estimated, because once a client is in need of having treatment, or the ARVs are dispensed to them, that they have a commitment. So the Guyana government has a commitment to continue to pay for those drugs for the rest of that person's life. And typically, someone that is adherent and takes their drug regularly and keeps a healthy lifestyle, they will live many, many years. They may live until they're 60. So you have a 25-year-old that's now going to live possibly as long as 60, till they're 60 years old. You have to promise, once you initiate them on treatment, that you're actually going to continue to make those drugs available to that individual. So they are allocated that money and for the resources that were required for those drugs. And those drugs cannot be assigned to a different person. So it's interesting because the stocks and the pharmacies play a very important role in keeping track of all these drugs, because they're given for free, but they're actually, most of these drugs are quite expensive. So there are lots of resources that are being brought in from Germany and France and the United States and Australia, different organizations who donate money to actually pay for these drugs. And so you have to keep track of them, and you don't want them to be sold on the black market. So record keeping is very important. So here we are, Guyana. The initiatives they have there for the Guyanese HIV/AIDS Reduction Prevention Program, which was called GHARP, not GARP, but GHARP. I had the name wrong when I first started working for them. You can see some of the types of things that are trying to promote HIV prevention, saying respect yourself, and protect yourself. The only faithful person you really know is you, so you have to protect yourself. It was one of the successful media campaigns, because again, this is an English-speaking country, former British and Dutch colony. So here is our Georgetown map. So this is the capital city of Guyana. And remember, the population for the whole country is less than 1 million. It's quite a big country, but much of the interior is undeveloped. It has a lot of mining going on for minerals and gold, emeralds, different types of precious stones. So it actually has resources, but they're very remote sites. Most of the population is right along the coast. And we have to remember, Georgetown is actually below sea level. Being a former Dutch colony, they have a whole row of dikes, very much like the wall that surrounds Universidad de la Sabana along the coast. And they have pumps that constantly pump the seawater out, because Guyana, or much of the coast of Guyana, including Georgetown, is below sea level. And so it's very flat. When you're walking around, and you can see the streets are on a matrix. So I want you to take a look at this map. You can zoom in on your electronic copy, or you can get your iPads out, get your iPhones out, start looking for different features within the city. You have the locations of the current sites. I want you to choose a new site for testing and counseling, and then be able to justify why you've chosen that site. Maybe there isn't another site closer, or you say that this HIV site may be overwhelmed with work, and therefore you're going to build one in close proximity, or there might be an area like a whole bank of restaurants or even casinos, and you think, okay, well, if they're going to have casinos, they might have alcohol, and they might also have commercial sex workers, prostitutes, and therefore we would want to have the counseling and testing site there. You justify why you've chosen it, or it might be in an area where there is no testing site right now. So there are some areas you can see in this area here. it's a more of a vacant area, but there also, it might be underwater. There are areas that are national parks or state parks, or so that might not actually be a populated area here. It might be something, I think there is a big park, very beautiful, where you walk through and it's got rivers and play areas, soccer fields and so on. So you choose the site, your building materials will be provided. So again, you're going to have a steel railroad car, so we saw an example of that will be approximately 700 square feet. So the internal space is quite small. Now that doesn't mean that you cannot have awnings or request to make a foundation with a patio area or seating area outside. You have to be creative because again, you want to have throughput. This is the highest HIV prevalence in the region. So you're going over South Africa at 20%. There are going to be lots and lots of people who should be coming in to be tested. So let's figure out how we're going to get them through and in this limited space. You're going to have a cement pad at the site, you need to designate the location and how you want to have it oriented. All necessary office equipment, including computers, HIV test kits, because that's why you need to know your volume. We're going to be looking at budgets and thinking about how many people you'd likely to treat every month or every year, however you want it, every quarter, however you want to divide it. So this is an example of a wellness center here. It was built in South Africa in a site near where we were working with the ICAP program when I was working there. And so this is much, much bigger structure than you're being given because you're only given 700 square feet. So be creative, put awnings, make a patio, do different things that will allow you to have the client waiting areas that you'll need because people come early in the morning and sometimes they expect to stay all day waiting for their chance or their appointment. And because it's so expensive for them to pay $2 or $3 to ride the bus to get there, they come and they spend the whole day. And sometimes they bring their children, they bring their grandmother, and so these individuals will be coming not necessarily just by themselves. So keep that in mind. You need space for families and kids to run around, and toilets for them to use, and water, accessible water, and how can you get people to have small kiosks for vending they could sell bottled water, juice, fruit, different things. So keep that in mind. I'm giving you a whole map of Guyana, and so each of these maps also has the individual voluntary counseling and testing sites and the different care and treatment sites that they have located. So you can see these are all designated by these names of their locations. Again, these are the areas that are along the coast. We've got this other map that's actually of Georgetown, and you're going to be locating your site in Georgetown. And keep in mind that HIV prevention and prevention of mother-to-child transmission are the keys. So go for it. Thanks.